men's mental health. Jeff Campbell, trail running powerhouse, 4-time trail walk winner and wellness advocate. And Euan Humphries, who is the captain of Kowloon RFC, EY consultant and testicular cancer survivor. This will be moderated by Tom Hutchins, who is, as many of you know from last year, also a survivor and advocate. So let's welcome Tom and the team.
Thank you, Henry. Can you guys hear me at the back? Okay, good. I know the kitchen girdle makes it a bit hard to hear. Yeah, thanks very much everyone for coming along this morning. Really great cause and great first panel conversation about the mental side of things. Now we're going to pivot to the physical side of things. I think for men generally as well, physical health, it always, the conversation always starts with a problem. There's an injury, a pain, or a scare. We're fine-tuned, I think, to be reactive rather than proactive about it. So what I want this panel conversation to be about, and this general conversation really, is to really flip that switch and say, well, okay, how can we be proactive about it? And rather than thinking that, having a bit of health paranoia, thinking of that as a bit of a weakness, actually think about that as a bit of a strength. So I'm joined by a really, really incredible panel. Looking forward to what we're going to be talking about. We've got industry expert, athlete powerhouse, athlete survivor, and we're going to cover a variety of different conversations. Just before we get started, just quick intros, please, gents. Colin, we'll start with you.
My name is Colin. I am a physiotherapist by profession. I have a special interest in men's pelvic health, so I'm defined clinically as a male pelvic health specialist. But I deal with a lot of men's health issues purely from a physical perspective, but also acknowledging that all of them carry some psychological components as well.
So my name is Jeff Campbell. I'm a lead trail runner based in Hong Kong. Competed for about the last 11 years. Originally from Canada. I'm a solicitor by my day job, and believe in men's mental and physical health.
Yeah, I'm not as impressive as these, but as Henry said, I'm a consultant at EY and also the captain at Colin.
Great, thanks, gents. Right, let's start kind of high level, I guess, with Colin and physical health. I think from the, we think when we think of physical health, we think of, I guess, fitness, and I think Jeff, you'll touch on that in a bit. But Colin, behind the sky, how would you define men's health and what it entails, and maybe what can we think about outside, our VO2 max and how much we can lift to the gym?
So I think men's health outside of men's mental health really focuses on the conditions that affect either men only or men more proportionally than women. So, for example, heart disease is the biggest killer worldwide in men. Women get heart disease as well, but men typically, we are much higher in that regard. But also from a physio perspective, we're looking at how do things like pelvic floor, the prostate, how do they impact men's health specifically? So when we take a kind of a broad look at men's health, we really want to focus on the things that are specific to men or the things that men are disproportionately affected by.
Great, thank you. And let's go, I want to hear about your two stories really. And Jeff, we'll start with you. I mean, you've got quite an impressive physical journey, really. If you could tell us about your, how you got into trail running and how you've managed to balance that really through the years.
Yeah, so I was a late comer to competitive athletics. I didn't start running until I was 32 years old when I arrived to Hong Kong, and met a few other runners, started to see my body transform. Actually got hooked up with the folks at Joint Dynamics and did some performance testing, and realized that I had sort of the ability to really improve, and just went on a journey where it was progressive years of training and getting into different levels of competition, and it's been a remarkable one. I also just really transformed how my life day to day was structured, because when you become an athlete and for competing in endurance sports, it takes a lot of hours that you need to put in every day. Changing your life habits, the structure around your day, to get in all those components of training, day after day. So really sort of changed the way that you approach your physical well-being, and just making sure that you're managing that project well.
I'm just curious, just to get the personal touch on this. How did you, from the getting into running at 32, then turn into the 4 or 5 time trail runner champion that you are?
It's I think a combination of factors. We're all sort of we're lucky with different sort of genetic traits. So I think I probably had some predisposition to endurance sports that I hadn't really known about. But then you just need to figure out what are the ways that you can put in the training that's required. There are ways to get better. And really just consistency, right? And also goal setting, right? So, you need to figure out, what you want to achieve within, the given window that you have, and then, putting in place the plan and the structure around that.
Sure. The genetics is a great excuse actually for not being a champion. I think actually going on to you, you said your knowledge is pretty impressive with these two guys, but I disagree. If you could just please tell us about your diagnosis, your treatment, and your recovery really from testicular cancer.
Yeah. So I think my diagnosis obviously came out of the blue. Nobody probably expects to get told they've got cancer, so I guess everything is pretty taboo subject when you talk about that. But at that time in my life, it was super unexpected for me and my family. So maybe give a little bit of a background, because I can see a lot of the lads here have this very similar background to me from a rugby basis. But from as long as I can remember, little boy, I was always obsessed with rugby, always wanted to be a professional rugby player. And kind of coming up through my teenage years, I was lucky enough at an international age to kind of represent where I was from. And what that basically meant was from a really young age, I had access to top class physios, S&Cs. So I think from 14, 15, 16, I was probably really aware of my body, in terms of physically, compared to a lot of my mates as well at the same age. So I think kind of going back to men's health and awareness, I was definitely more aware of my body than what my mates were. And I kind of progressed throughout university, and then as I finished university, I lucky enough to then go to full-time rugby, and I think at that time I probably had a cloak of invincibility on. It was you achieved a dream and you think, oh yeah, this is all good. And I remember going to my first pre-season, and there was a guy there called Sam Leeming. I don't know if any of you boys that have played in the UK know Sam, but he was somebody I'd seen and a professional rugby player. And I remember we were doing an analysis session, and he came up the stairs. There was only 2 flights of stairs. And he was drastically out of breath, So that's weird. He went and got some further checkups, and he had found out that he had a very rare form of non-Hodgkin's lymphoma. So basically, he had a tumour on his chest, but 19 centimetres, and he was still training with us. So that was I think the very first time my experience of Jesus, this guy has been a professional rugby player for the last 2-3 years. If it can happen to him, then that's a scary thing, right? And I remember that was the first dent in my invincibility cloak. And the head physio of the Reds at the time, he was actually also a testicular cancer survivor, and he gave a talk on, he was associated with the charity Oddballs. Don't know if lads have heard of Oddballs, but basically similar concept, testicular cancer. And he just basically told us how you go into the shower and check for yourself. And I think, had I never heard Sam's story, I would have been I don't need to go and check. But funnily enough, so he gave that on the Monday. I went home that night, checked in the shower myself, and I found a lump, probably about the size of a pea. This one. And so I straight away Dr. Google, instantly the worst thing to do. I went back and saw the physio the next day, and he was like, look, I don't think it's anything, but let's just go and get a scan. So this is a Tuesday night, go for the scan. Wednesday morning, we had the day off. I wake up, it was 8 o'clock, and I saw 4 missed calls from an unknown number. So I thought, that's weird. My dad rushes through the door, and he goes, hey mate, the doctors have called. They'd asked us to come in ASAP. So I was instantly I knew something was wrong, right? And it was probably the most silent journey I've ever had in my life with my dad. We were just both a bit awkward. So yeah, found out on the Wednesday that the lump that I'd found was just a benign cyst, right? So I was lucky. But what it had shown is that in my left testicle I had an early onset tumour. So on the Thursday, went to see the specialist. Friday, saw the surgeon. Monday, I had the surgery to remove it. And I think, so that's kind of the diagnosis. And then kind of moving into...
how old were you at this time?
I was 20, so...
Jesus.
Yeah, so probably, as I was saying, like, obviously it's unexpected for anyone, right? But at that age, like, peak physical fitness, I was just like, it was really shocking me and my family. So anyway, Monday had it, and then I think the recovery part, the treatment recovery part, was probably the hardest part was those 2 weeks after it. And going back to the mental health side was, I just kind of, I didn't want to, I don't know if I didn't want to tell it wasn't like I was embarrassed in terms of it. I didn't want to kind of burden my mates with it. I was just thought, all right, I'll just stick it with my fiance and my parents. And I was just like, yeah, I think, I'll just deal with this myself. And I think that was probably, now looking back, was probably the worst thing I could have done, right? Just not spoken to any of my mates. I think as well then, leading up to finding out the type of cancer I had, it was pretty hard for me and my family at the time. And my girlfriend said, she was like, I think you should tell your mates and I think you should speak about it and like get it off your chest. And I was like, no, it's fine, it's fine. And so she messaged my best friend and she let him know what was going on. And so it was about 2 days before I found out what the results of the tumour were, and my best mate called me and he was like, hey, Hughes, sorry, I'm allowed to swear. Yeah. He was like, right, let me see your fucking bollocks then. So, and obviously I had no idea he knew, right? So it's like straight away, I can't tell you like how much weight was lifted off my shoulders. And I think it's very similar going back to like the rugby side of things. Like if you've got a problem on the pitch, super cliche, right? You can't just sort it out yourself. You generally need your mates to help you out. And so kind of looking back, I wish I'd had like that blanket of mates to be like, it'll be all right. So yeah, and then I found out the treatment, and then my recovery was, again, I was super lucky, right, because I was in that professional setup, so had access to, again, a lot of really good people who nursed me back to health. So I always find it when people say like how unlucky you are to get testicular cancer, but as well I feel like the stage that I'd caught it, the time that I'd caught it, the situation that I was in, I was also really lucky. So yeah, that's just a little bit about it.
I mean, again, I think 5 years. Did you say it's
been? Oh, actually, it's 5 years to the day, 29th of November. Yeah.
So all okay now?
All good. Yeah, all good. Back
to a bit more about the recovery and balancing and community. I know it's going to be the last panel as well. Colin, we'll go to, again, I think you've got a few insights that are, outside pelvic floor. There's a few things, what else can we look at from men from a physical standpoint to really look after us?
So, I think to your point, I think getting guys to self-examine every month is really important. So everyone thinks that cancer, they stick it at the far end of their life. So it's going to happen when they're 50 plus. Testicular cancer occurs between 15 and 35 mostly. It can occur older as well. And so just trying to get young guys just to start checking themselves in the shower. It's not like we don't spend a lot of time fondling ourselves anyway. So we can just make it a bit more useful. So, checking around the balls, they should more or less be the same size. One hangs slightly lower just because of the architecture. And they're sort of spongy, and there's some wiggly lines at the back which are fine, and they're good. But what they shouldn't be painful. There shouldn't be any lumps, shouldn't be any bumps. First day of the month, in the shower, have a quick check. So soak your hands up and just rummage around and see what's there. One man every hour, every day is diagnosed with testicular cancer. So it's really important. And it's the most easy cancer to treat, but it becomes difficult because of neglect. And people die simply because they just aren't aware that they should be checked. So that's that takeaway. Coming a bit later, actually, guys, you should be checking your breasts as well, because men get breast cancer as well. I think about 400 guys in the UK every year get diagnosed with breast cancer. So it's worth, while you're in the shower, doing that as well. But then as you get on in life, I think it's important to get your prostate checked. I think prostate cancer is becoming much more prevalent nowadays. And the guys I see are the guys that are going into and coming out of prostate surgery. And they're all ages. My last guy that I worked with was 40 years old. So again, that's not how what you would expect. You'd expect them to be much older in life. But the consequences of radical prostatectomy are things like long-term erectile dysfunction, long-term urinary incontinence as well. So you want to make sure that, when you hit sort of your 40s, or even before if you think about it, every year just go get your PSA check, which is the blood test that will sort of help the doctors decide whether there is a possibility for prostate cancer. But also, everyone's frightened of that rectal exam. But you know what? It gives you so much information about your prostate. It doesn't take very long. And the guys that went, did you get it checked? I know that some people will be going to get their prostate checked. Did you get a rectal exam as well? Or they just do a blood test?
Ultrasound.
Just ultrasound. So the other version is ultrasound as well, and they can do an MRI. So you don't have to have the digital rectal exam, but honestly, if you get all of those done, you get much more information for that.
And then, I mean, that's from the checkup perspective, right?
Yeah.
When we go to the doctor, we make an appointment or stuff that's organised through charities. What about on a day-to-day basis that we can check at home? That you mentioned, you can obviously check for lumps and things of that nature.
So one of the things I was going to talk about, if I do these talks, I want people to come away with a bit of information. So, sorry to eat up a little bit of time, but pelvic floor, 3 layers, and it's involved in your bladder continence, your bowel continence, erectile function, and all sorts of pains that occur in the lower back and within the pelvis as well. But one of the things that guys struggle with are things like constipation, chronic constipation. I'm going to show of hands. How many people go and poo every day? Awesome. Put your hands down. How many people go every 2 days? How many people go every 3 days? So the normal range is a bowel motion between 1 and 3 days. So if you're sort of a bit further, that doesn't matter. What I want you to do now is close your eyes, and I want you to sit on the loo as if you're having a poo. And show me what position you're in. Lovely. So if you're leaning forward, it's the best position to be in. So I've got a couple of leaflets called the bottom line. Would you mind just passing some of these out? So a friendly handout on a couple of these. So on this side, the defecation dynamics, basically, what guys struggle with is often we're inconsistent in when we poo. And really it wants to be easy and it wants to be quick. And if you're sitting for longer than 5 minutes, you should need to get up and walk around. You think that hour sitting on the loo straining is not a good idea. Shouldn't be paid for. And basically that sit forward. Sometimes you'll hear people use a squatty potty where they'll raise their feet up. But most guys' hips aren't that flexible. So if you're leaning forward, it basically straightens out the poo shoe and just mechanically allows it to come down. And also the idea of men strain a lot. We see this a lot with people who are heavy gym lifters because they use their pelvic floor to kind of help brace themselves when they're lifting heavy. And the idea is that you shouldn't do that. The pelvic floor can't take that. So what you want to do is, instead of actually really pushing down hard when you have a poo, you want to kind of use your breath to help you with that. So as you're sitting forward, I'd like you all to do this because it's an experiential thing. You sit forward. You want to imagine you're going to just open up your rectum and your anus to have a poo. And I want you to basically use your breath. So you're going to take a big breath in and blow out as if you're blowing out candles. You can also make sounds. So you can, if you're finding it difficult, you can go moo. We know that helps as well. So what you're trying to do is you're trying to create abdominal pressure to help you defecate, but without straining, because that's just going to cause problems with the base of your pelvic floor. Thank you very much. That's the
I see. Routine is really important. So I try to structure my day around getting in my first run of the day early, and I actually run to the office. So I don't try to think about, am I going to get this in? It just becomes part of the structure of my day, and I run home most days as well. Just being accountable to yourself. For me, I have a family. I have quite a busy corporate job. The running is sort of my own thing, my own project, it's nice that it's something that it's the goals that I'm pursuing, and that gives me some ownership over that. So yeah, I think routine is probably the biggest part of that.
And then Euan, from your perspective, obviously with that whole experience that you went through, it's great to see that are much more open about it now, speaking to your friends. I mean, how has it impacted the way that you reflect on your own physical health and men's health in general?
That's a good question. I think the main thing taking away from me is that everybody is their own best judge of character around their health, right? And I feel like when you feel like there's something wrong, and you feel like in a gut, like, oh, that doesn't feel right, there's no harm in going to get things checked. Like it's to the earlier point is testicular cancer is just like relating back to that. It's one of the most curable cancers, right? And it's such a taboo subject. Like cancer. Yeah, it's a horrible thing. But I think because it's such a horrible thought, lots of people put that to the back of their minds. They don't want to deal with it. They're like, nah, I'm okay. I don't have that. Whereas if we acknowledge early and we go and get checked early when we feel like something's wrong, 80-90% of the time they're going to be like, yeah, it's just you're under the weather, or yeah, this is what it is. But it's those 10-15% of the time that you go, oh, actually, yeah, there could be something here. So kind of reflecting back from it now is more the main thing I take away from it is more just like trust in your own gut. If you feel something's wrong, it takes an hour to go and get checked in a day or whatever it is, a month. There's no harm in going to do that.
Thank you. I'll do 2 minutes. All right. I think just very quickly, one kind of takeaway from you guys. I'll go around. I mean, what would be your advice if you have one piece of advice that one person will take away today about mental health? What would it be?
If you start losing your morning erections, the research shows you have about 30 months before you can possibly have a major heart event. So if you're noticing that consistently you're waking up where you used to have a good, strong, solid erection and you don't anymore, or it's less than it was, go and see a doctor and go and get your heart checked, because it's one of the biggest proxy diagnoses we can have for heart disease, which is the biggest killer in men.
For mental health, I think just having a really solid network around you, so whether it's friends, whether it's teammates, coaching staff, colleagues, and just really having people who you're comfortable sounding off for advice. And in my experience, it's a really good way to make sure that you're getting what's off your chest, but also being there for others. So I think Hong Kong is a really special place in terms of a lot of people who are always looking to help out, and just maintaining that network around you is really important, I think.
I would say to 21-year-old Euan, I would say make sure you're okay first before you help others. Like it's like on an airplane, right? You sort yourself out before you can help people. So like you're not going to be able to give any good help if you're not right.
Thank you very much, guys, for your answers. Really, really insightful panel. Thank you. Know your own personal milestones. Check in on yourself. Send that text to that friend. Get that checkup. Don't put it off. But yeah, thank you very much, everyone. I think on to the last really exciting panel.
Thank you very much, guys. I think some really powerful messages there around getting checked early.